as you can see, we want to break the ice really quick, because also here already ask your questions, make your comments. Who starts?
Hello?
Yes. Can you use your microphone?
Well, it does not work. Sorry. Switch it on.
You have to switch it on.
It's a trick, thank you, sir. Well, the question is very simple. We see very often the right chamber fail. So it's here. And you give us the excellent example. How do you overcome this failure of the right side of the heart? Can you give us some more insight of this outside pump or whatever? I didn't get it. Kindly evaluate it more.
Now, this is a catheter to the heart. So catheters are the mainstay of interventional cardiology. And this is a very novel catheter which has a pump like this at the tip. This pump pumps 3.5 or more liters of blood per minute through a 3 millimeter, 4 millimeter cannula. And so the point is now to introduce on the right side this pump through the vein from the leg, through the right heart to the pulmonary artery. So we aspirate 4 liters per minute here in the right atrium. We pump it to the pulmonary artery and this way replace the right heart. And that means the patient does not need his left ventricle in the acute situation, which is infarcted, and he does not need his right ventricle in the acute situation, which is also infarcted. But at the same time, this gives him a circulation and protects his heart so that it can recover from this infarction. And that's what we have seen. Amazingly, this patient, if we measure biomarkers, had a huge infarction, but after half a year, pump function of both ventricles have near normalized. So this concept of saving the patient, but at the same time allowing recovery, will become important.
Thank you. Congratulations.
Juliana.
So, Patrick, thank you very much for this very interesting presentation, and I completely agree with you that the cost of healthcare is going out from what we can afford. And you were making the point that we need personalized medicine, genomic-based and effective, and just reimburse that. However, even in your professional, the cardiovascular diseases, they are now can be prevented with some of the medication, and I think that for society that would be important to consider the prevention of cancer or cardiovascular or infectious diseases, and right now this is, I think, a little bit less emphasized in the personalized medicine field.
Yes, and I agree with you, and this certainly also depends on the disease type. Each disease type needs a different approach. For example, in malaria, we know that if we break the infection cycle, we can eradicate the disease worldwide, like it was done with pox virus. The problem is a little bit more difficult because there are animal reservoirs, and there are poor country, and there are wars. And wars are the worst to prevent disease eradication because people don't adhere to whatever, cannot adhere to whatever. Now, in cancer, I believe that we cannot eradicate cancer because it's very difficult to predict, because there is not a single cancer, but each cancer is different. And that means we cannot guarantee to anybody that he will not develop a cancer. So we need to look at cure for this individual. In contrast to arteriosclerosis is a disease where you have a time window of 10 years before it becomes clinically manifest. If we find ways to identify this arteriosclerosis and then apply a single, hopefully, treatment to stop this disease, this patient will never come to the hospital with a myocardial infarction. So on a societal basis, I believe this is an eradicatable disease.
Just a little note for the cancer prevention. So there are already, you can predict, for example, through BRCA mutation and so on for women, some of the women or some of the people for prostate cancer, based on the genetic background of these patients, to which kind of cancer they might get. And that cancer, what they get, is also predictable. So I think that development of vaccines which protect these people or decrease the chance to these people to get cancer would be feasible in the future.
Thank you. I agree. Yes.
I was interested, I may have missed it, but you never mentioned neurological diseases, dementia,
Well,
Alzheimer's. Is that too difficult, too far out?
No, it's also in the kind of, if you look around, there are also people working on that. It's a gap in my presentation, I apologize. But it's certainly true that if you look at the global burden of disease, then neurologic disease are a very important piece of it. Yes?
Donald Bruce from Egenetics, and also with you on the NanoAthero project. The thing that strikes me coming from, as coming to this conference many times looking at ethical questions, but not being medically trained, is when you said how much repeat intervention. That long list was very, made quite an impact on me. And so I can see where we are now and where your vision is for where you want to get to. But between the two, to join them, it seems, will you not have the same phenomenon that we make the first interventions with new technologies like nanotechnology, and it helps a little bit, but you need a lot more interventions. So may there be many steps before you get to this stage where you can talk about eradication. So will the problem of repeat interventions actually be something you would almost expect to see?
No, I mean, I have to say that this was a kind of extreme example. Not every patient comes back several times in the first 2 years. Some patients we don't see for 10 years, but then they come back then. But the problem of repeat interventions is a different problem than the problem we initially treated. Initially, we treated a clinical manifestation of arteriosclerosis, but we lacked the capability of profoundly impacting the progression of the fundamental disease of arteriosclerosis. So this shows the dissociation of acute treatment of life-threatening disease and mastering the bottom disease itself. So it's not, if we find ways to treat this fundamental disease at the bottom, then we don't expect to see the patient coming back because this disease will not progress, hopefully. But this is the future we aim at and not yet the reality.
So we will take a last question now before the break, afterwards many more.
I think there is still, my name is Professor van der Voorde. I have 30 years European research career behind me. The point what I wanted to put is the following. You very much and well demonstrated that we need more money for doing the research in the future. The point what we have here, if we look about all the programs in Switzerland, nationally, on the European Union, the Horizon program, in respect to the nanomedicine or the money available for nano, particularly in the medicine field, is quite low. I think it would be very useful that at the end of this Congress, a strategy is being developed in order to see how can we improve the collaboration between the various nations and the various programs in the future, in the next years, and what are the collaborations possible with America and also China, even Japan, into the field of nanosciences. I think it would be very useful if such a kind of a strategy document could be made available at the end of the conference, in addition to all the medical topics which you are putting forward.
Marcel,
Kind
you
of an
speak
advice.
out of the heart of Clinam. You really state something which is very important, and you know that tomorrow we shall have the regulators from all continents here, and I think we are doing big efforts that internationally the cooperation is here. If you go through the list of attendance, you can see that we have today from 41 countries the people here in Basel. 480, almost 476 people are here registered now, and I think we will go that way. I mean, you have always been a visionary to change up and down the world, and it will work. Ladies and gentlemen, before we go to the break, I want to tell you that we are so glad that Aaron Cechanover is with us, the Nobel laureate who will speak on ubiquitin after the break. Have a good break, have your coffee, and we are looking forward afterwards to a great session.